Hi everyone, welcome and thank you for giving up your precious time to come join us and watch this video today. This webinar is introducing Student Mind's new guidance, Planning for a Sustainable Future, the importance of university mental health in uncertain times. It's a precursor to our Q&A webinar on the 23rd of June. We've got an incredible lineup of speakers who will explore further how and why universities can make mental health and wellbeing a strategic priority in a COVID-19 context. So I'm Leigh. I'm Sector Improvement Lead here at Student Minds. I head up our two sector improvement programmes, the University Mental Health Charter, which we'll explain a bit about in a moment, and the Student Union Support Programme as well. I'm joined by my colleague Gareth Hughes, who's a psychotherapist and research lead for student wellbeing at the University of Derby and co-author of the University Mental Health Charter. Say hi, Gareth.
Hello.
Okay, great. So first, I'd like to say I hope you're all safe and well. I know it's been an incredible, challenging time recently, and I'd also like to say thank you. Student Minds have been absolutely overwhelmed with the response of the sector, of staff and students, like really coming together over the past 2 months to support one another through what has been, an immensely challenging circumstance. So just like to say to everybody watching right now, thank you for your role within that. It's been amazing. And we've been absolutely bowled over by universities as well. They've achieved incredible things over the past couple of months for staff and students, all by prioritising their mental health and safety and well-being. What we want to do through this guidance is just call on universities to ensure that prioritisation of student and staff wellbeing continues as they start to think strategically about what their provision looks like both next year and beyond. So today we'll just go briefly through who Student Minds are if you've not come across the charity before, and a bit of a context about how our response has changed since COVID-19. We'll explore a bit about what we know about the impact of the pandemic on university mental health and wellbeing so far. And then we'll introduce our guidance, Planning for a Sustainable Future, and outline the 7 principles that universities can apply in prioritising mental health and wellbeing in their planning for next year and beyond. So who are Student Minds? If you've not come across us before, we are the UK's student mental health charity. We started just over a decade ago as 2 student-led societies. So one was a peer-to-peer support group for eating disorders, and the other was a student-led campaigns group. And we've really kept that kind of student-led, students supporting one another aspect really at the heart of our work, and we still continue to organise those groups today. But since then, the national charity has grown. We also worked at the sector level with student unions, universities and accommodation providers. We provide training for staff, as well as the 2 improvement schemes I mentioned before. So the University Mental Health Charter, which sets out how universities can take a whole university approach to mental health and wellbeing. And also the Student Union Support Programme, which equally talks about how student unions can create a whole organisation approach to mental health and wellbeing. And we support them to achieve that. We produce digital resources. So the Wellbeing Thesis was launched in January. That's a really cool digital resource for students studying PhDs and early career researchers about how to manage any challenges to their mental health and wellbeing. We're also involved in a lot of research and policy. So we work with the Student Mental Health Research Network, SMARTN, and key organisations such as the Office for Students and Department for Education, looking at those kind of national challenges to student mental health and wellbeing and how we can have a positive impact there. Since lockdown, what our work's kind of changed, as was everybody's. The first thing we did was to produce a coronavirus resource page for students, so that has all the resources students need to support their mental health and wellbeing through the pandemic, and look for help if they need it. And we keep that updated regularly with any new information that comes out there. So universities can just use that as a link rather than gather all those resources themselves. We have really focused on listening to staff and students to really understand their needs and experiences of the pandemic and understand how we can support them. So we've started to do bi-weekly pulse surveys, which I encourage you to go and take part in, which have had incredible insights into the needs and experiences of staff and students over the past couple of months. We've analysed over hundreds of sources from media reports and research to really understand how staff and students are experiencing or have been experiencing in the last 2 months. And working with our networks and having conversations with students and the staff that we work with on a daily basis as well. And that's really informed the rest of the work that we've done to support staff and students over the past few months as well. So from all that listening and insight, we wanted to create resources for students. So that means adapting our current student support activities, such as the peer support groups, and seeing how they can apply in the new context, as well as developing specific resources for students, which are in the pipeline. We also wanted to support universities and the wider higher education sector, such as student unions as well, to support their students and their communities. So planning for a sustainable future, the guidance that I mentioned, that is the first output of that work, informed by our listening, which we'll explore in just a moment. We've also been working not just at the student level and the sector level, but with key organisations at that kind of national level, so Department for Education, Office for Students, and key mental health charities, looking at what mental health support for the sector, for students, and for society at large looks like, and what kind of national responses are needed there as well. So I will hand over to Gareth, who will now introduce what we know currently about the impact of COVID-19 on university mental health and wellbeing. Take it away, Gareth.
Thank you, Leigh, and again, thank you everyone for joining us and for being part of this and being part of the webinar overall. I wanted just to start just by putting a few notes of caution in terms of the around what we know, because I think one of the things we have to be very careful about as we go through this period is not to make too many assumptions. As human beings, we very quickly want to move to creating the story of what's going on so that we can then plan and make decisions. And actually, we need to be careful because we don't really know what this is going to be like as we continue to move through this pandemic for ourselves or for our students. And we're kind of discovering almost on a week-by-week basis different aspects of this experience, how it affects people in different ways, how the time period is affecting people differently. So we need to be very careful, and the information we have at the moment is partial, and it will remain partial because the experience will continue to develop over time. So we have to be making sure that we are listening to all the members of our university community, to everyone across the sector, to all of our students, to all of our staff, to make sure that we are basing our decision making on what is actually happening and what people are actually experiencing, rather than our best guesses. And that's difficult because we're having to make decisions in advance very often, and we can really only work with the best information we have right now. But I think we have to try to stay flexible. We have to try to continue to listen and gather that information and hold to our principles that, you know, the university sector is grounded in research and analysis and evaluation, and that we continue to make our decisions and our behaviors based on the best available evidence that we have right now, and that we continue to listen as much as possible. But what have we got and what do we know right now? If you can put the slide on for me, Leigh. So one of the first things really, again, is another note of caution really, is about us being careful not to leap too far ahead in our thinking about the impact this is necessarily going to have on mental health, short, medium, or long term. Emotional responses to what's going on right now are absolutely normal. It's normal to be disappointed if things aren't happening that you wanted to. It's normal to be anxious about the fact that you're living through a pandemic. It's normal to be upset if you can't see people who you care about and love and you're having to be separated from them for a period of time. It's normal for students to feel disappointed and disrupted by what's happened to their educational career. These are normal emotional responses, and that's not to say that we don't need to support our students and our staff with those feelings. help them to manage them and to bring them as much certainty and positivity as we can. But it's important we don't pathologize that we don't turn that into a mental illness, because that's a different thing overall. So there are lots of responses to this, and some of our students are seeing positives in the experience that they're having. Some of our students are finding positives in what's happening. They're finding that they're managing better. They're finding they've been able to pay better attention to their well-being. Some reports that some students are finding learning a little bit easier in this environment, although that's a balance I'll come and talk about in a little moment. So there are positives in this as well. So we just need to be careful not to get too drawn into all the talk about the tsunami of mental illness that's inevitably coming, because it is not inevitable and it will not necessarily be a tsunami. Some people will be affected by this, but it won't necessarily be a whole population negative impact that endures in the long term. We have to be careful not to make that assumption. If it comes to pass, we need to be ready for it and we need to work with it, but we can't make the assumption that that is necessarily what is going to happen. And we need to focus instead on what the evidence is telling us about where need is currently growing. Now, unfortunately, one of the things we are seeing is that students do appear to be one of the populations who are experiencing the most negative impact right away. So students and young people particularly, much more likely to be experiencing higher levels of anxiety, higher levels of hopelessness, higher levels of low mood and things like that during this period of time. Also much more likely to be feeling that sense of socialization and loneliness. And we know that there are many students who have unfortunately ended up living by themselves through this whole period of time, and that is something we should be paying attention to. We are also getting a mix of evidence about how well students are able to engage with their learning in the online space that's been created. And we need to be careful what students are engaging with at the moment. It isn't really proper online learning or distance learning. It's what we would categorize as emergency remote teaching. Some students are saying, and we're seeing some evidence that some students are saying they are finding that a bit easier and that there are some advantages. So the fact that room with other people distracting them or disturbing their attention, they're finding makes learning easier. But I think in the range of different surveys that we're seeing, we're getting different headline responses. And I think that's because this is impacting differently on different communities. So it depends on who the survey has got to. Some students are saying, yep, we're feeling that. Other students are very clearly saying we're finding it much more difficult. We're really struggling to extract learning. We're really struggling to engage in our course. And that's having a negative impact on motivation. We're seeing a motivational drop with those students in the feedback we're seeing and the evidence that's being gathered so far. So a different impact from all of that, but very clearly some of our students finding it much more difficult. Obviously, anxiety about the future is high amongst the student population, particularly amongst those students who are finishing now. And my guess probably for those students who are going to be finishing next year. A sense of imposter syndrome being expressed by some of those students, the feeling that my degree isn't proper because I didn't finish it properly, because it was disrupted. I didn't sit the exam people usually sit. So there is some work to be done in helping those students to recognize that actually a degree is not the bit of paper at the end. It's not the final assessment. It's the 3 years of learning. You still have that. So there are some work to be done amongst all of that. And then a real concern about the impact on staff well-being. And as Leigh said, staff have worked miracles in a short space of time. I mean, it is extraordinary what many staff are doing. The transfer of learning and services into online delivery almost overnight was extraordinary to watch. I mean, it was quite amazing what's happened. And people have really done their very best. But we do need to be careful that we don't burn out staff. It's not going to help if we get to September and find that all of our staff are burnt out, because the teaching that needs to happen in September, the support that needs to go in September is going to take energy and focus and concentration and reserves of enthusiasm. And if staff don't have that, it's going to be very difficult for us to sustain our practice, both in terms of teaching and support. So we need to make sure that staff wellbeing is not being neglected through all of this. The other thing that does seem to be coming out from the data that we're seeing is that what universities are doing and how they're engaging with staff and students very clearly seems to be having an impact on the well-being of staff and students. So if we take, for instance, the research that was done under the SMART umbrella looking at postgraduate research students, and you can very clearly see a very, very strong correlation between how students are feeling and the clarity and regularity of communication between them and their supervisor and the institution. Where institutions and supervisors have been engaged with the student, they've communicated, they've reassured, they've been flexible, they've made adjustments to regulations given the circumstances that they're in, students, clearly their well-being much better. Where students feel that they've not been contacted, they've not had clarity about what's going on, where they're feeling a bit lost, well-being much lower. So what we do at the very basic practical end as universities has a real impact on our students and on our staff. Can you flick on, please, Leigh? So I just want to pick up again then on that point we made earlier about the fact that this is impacting differently on different groups of students. And there is a real diversity of impact that we should be very aware of. And this is something we do know now, and therefore is something we can focus our resources on. So you'll see there are a list of different students groups on the slide just there. I'm not going to go through them all individually, but just taking into account the fact that that is the case, that we are, for instance, seeing students who are experiencing financial difficulties, for instance, who would normally be relying on part-time work to get them through university, and now just have a financial gap and aren't sure how they're going to be getting through all of those. Students who have not had family to go back to, seeing particular negative impacts on them. We know that healthcare students in placements generally, so teaching students, healthcare placements, students who are now without their placement, who don't know what's going to be happening next, that uncertainty is impacting and kind of impounding on top of things that are already happening. Students with pre-existing mental health conditions is one that is chiming with all of the research that's happening, because it's true also of people in the general population. So where we have students who have pre-existing mental health conditions, it does appear that the pandemic is having an additional negative impact on those students, and that those students are going to need more support. And that has implications for, particularly for our support services in universities, that demand is likely to, at the very least, sustain, that we've been saying, and likely to increase. Can you flick on again for me, please, Leigh? Mm-hmm. So why is this important for universities? I mean, this is something that, you know, if you've engaged with anything Student Minds has done before, you will know. But we know that there are real clear links between well-being and mental health and student learning. Lower levels of well-being very definitely impact on students' ability to learn and perform academically. Clear impact on retention. Students much more likely to leave university if their well-being is low. And of course, satisfaction, and that all leads through into employability. So all the key metrics that universities are concerned about, rightly, where the universities are rightly have their attention focused, very heavily impacted by well-being and mental health. And then the same is true for staff. As I say, the ability of staff to adapt to what's happening, to teach. One of the key things that I always think about with teaching is something that Paul Kirshner talks about, which is that teaching is not what you prepare before you walk into the classroom. Teaching is what you do when students respond to what you have prepared. And that means, again, as I say, our academic teaching staff needs to have resource, energy, concentration, focus to be able to do that. Now, that's difficult enough in the classroom. It's even more difficult to do online, particularly if you're new to it. So we need to make sure staff well-being is good, because that has a direct impact on students, but also just because it's important for staff themselves. University staff are entitled to good well-being in and of itself. So we need to make sure that we're looking after all of that, because if we keep focused on what it is that we want our universities to be, we want our universities to be communities where people flourish and grow and develop and produce wisdom. And that can't happen in a situation where our well-being is not good. So the pandemic is having some impacts that we're having to manage. So we need to do that as best we can to continue to keep working towards the communities that we need to have, because universities are only going to be sustainable if staff can sustain the work, if students can continue to engage with their learning. If either of those things is not possible because the well-being of either part of the community is not good, universities are not sustainable. So we cannot ignore well-being if we wish to work our way through this period of uncertainty and difficulty and get to the other end. Can you flick on for me, please, Leigh? So what have we produced in our planning for sustainable? We've taken learning from the University Mental Health Charter, and we have looked at all of the evidence that's come in that we've been gathering, as Leigh said, through all of the pieces of listening exercises we've done and all of the research we've gathered together, and brought it together with the Charter. For those of you who don't know, the University Mental Health Charter we developed over the course of about 18 months, and it was an evidence-informed charter. We worked with colleagues, staff and students and sector bodies right across the 4 nations in the UK. We reviewed all of the literature. We worked with experts. We pulled together all of the learning and all of the knowledge that we have within the sector about what we know about the well-being of staff and students to construct the University Mental Health Charter, allied with work that had already taken place and that has since been revised in Universities UK's Step Change Mentally Healthy Universities, to produce a charter that looked at all the aspects of university life that could impact on our well-being for staff and students, and what we as universities could do in a principled way to improve on that. Can you flick on, please, Leigh? And what that basically recommends is that we need to be taking a whole university approach, because we know that everything that surrounds us has an impact of some sort on our well-being. It can impact on our mood, on our thinking, on our behavior. And so as a universities, we need to think about every aspect that touches on the lives of our students and staff, because otherwise we could be doing something that's having a negative impact, or we may be missing opportunities to have a positive impact. And as one of my colleagues argued a few years ago, every university in the country already has a whole university approach to mental health and well-being. It's just that some of what we do is well thought out and is hopefully having a positive impact, and some of it we haven't thought about and may well be having a negative impact as a result. So we need to think about everything that we're doing. And we broke that down across 4 broad themes and one collection of enabling themes, 4 domains and one collection of enabling themes, to gather together the 18 main themes of the charter itself. So let's look at how the sustainable futures guidance that we've put together breaks out under those kind of headlines of the charter. If you can click on me. Oh yeah, let me, sorry, just go back. I did just want to say one thing, which was the thinking about the whole university approach. It is obviously really important to think about a number of different elements, because sometimes people think that there are trade-offs in creating a whole university approach. That means we have to lose some aspect of what we've traditionally thought about. Whole university approaches do require services that are well-resourced, effective, and clinically governed and accessible to all students. Those are the foundation stones. We need to have those services in place to respond to student and staff need, but they are not enough on their own. We also need an environment that is generally conducive to good mental health and that promotes and supports good mental health and good well-being. And we also need to empower individuals to be able to do what they can do to be able to manage their own well-being. And we have to have all aspects of that. You have to have an environment that is generally good for well-being, and individuals able to manage their own well-being, and services that are available when students and staff need them, in order to really have a genuine whole university approach. If any of those elements are missing, then there isn't really a full whole university approach. So, okay, let's now look at the headlines. So we start with the domain of learn. Obviously, this has been a big focus for universities over the last few weeks and months, and in terms of how we move students into the online learning space. We're now thinking about how we manage the next semester, whether that's going to be online or blended, and then thinking these come back onto the campus at some point in the future full time. And we know that learning and well-being are really intrinsically linked together. We know that well-being impacts on learning. So we know that mental, physical, and social health has an impact on learning. So if we just take social health, for instance, we know that when someone perceives themselves as being lonely, cognitive functioning drops. And research among students shows that students who are experiencing loneliness underperform academically. So our well-being has a very direct effect on our learning straight away. But the way in which we engage with our learning and how successful we feel and our sense of competency, self-efficacy, and attribution also impact on our well-being. If students are learning deeply, if they feel confident about their studies, if they believe they can do it, they're being challenged with that desirable level of difficulty so they can feel that growth. And then when they do something really well, they're able to say, yes, I did that because it was me. That has a really powerful effect on their well-being that is really positive. On the other hand, if students are engaged, don't know how to do it, they don't know what's being asked of them, they don't understand it, they feel like they are an imposter, that they shouldn't be here, then that can have a negative impact on their well-being overall. So we need to be thinking about how we are supporting our students in these learning environments, particularly moving into the online space. We cannot assume our students are digital natives who know how to do this, because many of them don't. We need to be teaching them to use the online platforms we're providing before we ask them to learn through those platforms, because otherwise students are going to be using a huge amount of cognitive load just in figuring out, one, how they use the platform, secondly, how they can learn online effectively before they can even get to disciplinary content. And that will undermine their learning overall and will then result in them having those kind of negative impacts on their well-being. So we need to think about how we are scaffolding and structuring our teaching and our support through that transition process in for the new academic year, through the first semester and any changes that happen. And also we need to think about how we are inducting and orienting our students back into the classroom when we eventually bring them back online. And we need to treat that as if it was a beginning of a whole new year when we think about all of that. If you can flick on, please, Leigh. Again, as I said earlier, we know we need support services effective, accessible to all, that are well resourced and are well governed, and that are appropriate to the local context. The local context also being the current context of what we're doing. So obviously, lots of support services will have moved to online delivery, perfectly appropriate for what's happening right now. We do need to be aware of the fact that some students are experiencing problems in being able to access private space to be able to engage with things like therapy. So we may need to think flexibly about how we reach those students. But as OFS have warned, we do need to be aware of the fact that there may well be a rise in demand and a rise in need among students for support, and universities need to be planning for that. And I say that quite clearly because I know universities are having a tough time financially and are having to make some very hard decisions. At the very least, services need to be maintained at their current level. They may even need additional resource, and I know that's tight and difficult at the moment, but it is a fact of something that we do need to consider and think about as universities. Click on again, please, Leigh. Work, obviously, as we said, the well-being of staff, both in professional services staff and our teaching staff, needs to be taken care of through all of this. We need to make sure we are not getting through this reliant on our staff simply burning themselves out. And of course, staff have all the difficulties of working from home, still having children at home right now and throughout the summer. So we need to be conscious of all of that, and we need to not be over asking. Now, this may mean we need to strip back and simplify some of the things that we were doing in the first semester. We need to just let go of some things in the first semester of next year. Now, that's within curriculum and within practice, in order to make sure that what we're able to deliver to students is viable, that doesn't rely on burning staff out, and that also delivers to students the things that they absolutely really need. So we need to think about and also then make sure that staff have access to the support that they need, both in terms of line management, peers and colleagues, making sure that that social interaction can still happen, and access to formal resources as well, should they need it. Click on, please, Leigh. And then in the live end of this, we also need to be thinking about how we are going to be creating those student communities as we move into the new academic year. We know we have some students who are still in university halls of residence and student accommodation and will be throughout the summer. We need to keep an eye on those and be cognizant of the support that they need. But obviously, I know universities, from talking to universities up and down the country, really grappling with this idea about how we create the social community in the new year. How do we create that sense of belonging and cohort identity when we are likely to be doing a lot of this in the online space? And I think we need to be thinking about how we create formal and informal spaces online, and how we create spaces that students can share and use, that the university is providing, and not assuming students will do this through apps, because we know that mature students and international students may not be using the same apps that some of our 18 to 21-year-olds are using, and so can become excluded as a result of that. So we need to think about how we as in universities are explicitly thinking about and doing that. And we also then obviously need to think about our students in accommodation. How are households going to work? How are bubbles going to work? Do we need to put together bubbles in flats wherever possible of students who are all studying the same subject, so that we're not introducing more people into their space in that way? So lots of different kinds of things and considerations that we need to think about as we work our way through all of this. And then in our enabling things, we very specifically pulled out two, one of which is co-production with staff and students. I completely understand why universities at leadership levels may want to move quickly and therefore work with tight decision-making governing bodies that can reach decisions quickly and move forward. The problem with that, as I said earlier on, is that the real risk is that if it's not connected with what actually is happening and what we actually know about staff and student experiences, is that it might be making decisions based on assumptions which are actually wrong. And therefore we end up delivering an experience that doesn't meet what's actually going on right now. it's very difficult to do that retroactively if you haven't put that in place. So as much as possible, and I know lots of universities are doing this, to be organizing proper listening with staff and students, to be doing some regular insight work, gathering information, asking questions of your student population, asking questions of your staff, giving them lots of opportunities to tell you how they are experiencing things and what are going on, and then trying to respond as flexibly as possible to that, and to co-produce this. Because I think if students and staff feel an ownership of the co-production of what happens in the first semester, even though it may not be as ideal as we would like, at least if people feel they have some ownership of it and that they've had an opportunity to influence it, they may feel better about the experience they have. And then that other thing about the fact that, as we saw earlier, this thing is impacting differently on different groups of students. And we need to be constantly thinking about how that works, not assuming that all students have access to top of the range digital facilities, that some students are going to be doing this on their phone. And I think that's an important thing to think about when we're thinking about curriculum development and delivering programs. Can a student do it on their phone? Because if they can't, you may well be excluding some students from being able to learn and engage with those learning activities. I know it can be very tempting to use all of the most high-level technology that you possibly can to deliver as good a learning experience as you can. But if it's reliant on students having particular technology and software to be able to do that, and not all students have access to it, then you will be excluding some of the student population. So we need to be thinking inclusively, we need to be thinking flexibly, we need to be accepting the way in which this may impact on students' ability to do assessments around particular deadlines. We just need to have a very flexible mindset to our population as we move through all of that. And the other thing I would say in all of this is to be aware that we're not going to be able to deliver perfect, and that's okay. I think for staff, the university sector is full of brilliant, passionate, committed staff who want to do the very best they can do, both in terms of research, teaching, looking after their students, providing support. We have to accept that the first semester of next year is as good as we can make it, but will not be perfect. We have to focus on trying to make it as good as it possibly can be, brilliant if at all possible, but we cannot make it perfect because we are not working with a perfect situation. And that acceptance is really important, because this isn't me saying just accept that it's going to be rubbish. What I'm saying is that if we accept the circumstance and the reality that we're in, we can then work with that reality to make it as good as it possibly can be. But I think that's the journey we have to go through. Accept the reality, accept what it is, work with our students and our staff, work with our community, listen, gather the evidence, make the best decisions we can in the circumstance, and then make the experience as good as it possibly can be for everyone. And that then I think will deliver a better outcome than if we try to deliver something which we try to make perfect in ignorance of the circumstance. I think we're likely then just for us all to burn out and not to deliver a good experience. So that's the end of my bit of this for now. I look forward to hearing what people have to say in the webinar. I look forward to your questions, the debates and the discussion, and I look forward to learning from all of you. And thank you again for joining in.
Thank you, Gareth. I mean, there's a lot to take in there. So thankfully, you've got a bit of time before the Q&A to kind of digest all that and absorb it before you approach us with some of your queries and questions to explore some of that in more detail. All the evidence that supports everything we've written today is referenced in the guidance, which you can download on our website under the charter. We also recommend going to explore some of these challenges in more detail in the University Mental Health Charter itself, although that's not framed in a COVID-19 context, because there's masses of evidence and further reading and resources in there as well. I just wanted to say a final word about self-care, because I think, as Gareth was saying, you know, the higher education sector is full of passionate people, whether you're a leader, a staff member, or a student. You just want to do the very best you can for your community, which is great to be part of. But it also means we are, you know, threatened ourselves to be unsustainable, to try and do everything when there's so much to be done and there's so many people needing information, clarity, decisions, support, and experiencing difficulties. It's tempting to just try and fill your day with doing as much as you possibly can. But as I said, it's a marathon, not a sprint. You know, some of these changes we're making to university provision are things that normally would take years. Talking to a colleague at the Open University who said that, you know, it does literally take multiple years to develop an online program normally, and we're trying to do that in a few months. Transitioning all support services online, same situation. So they normally take a long time, and the changes are going to still be, we're still going to be learning, we're still going to need to adapt and implement months from now, and then transitioning back again into on-campus delivery eventually. So recognizing that it's a marathon, not a sprint. Take your time, you know, take as much, only do as much in your day as you physically can to maintain your motivation and your strength as well. And it's important to remember that. And role modeling of self-care, that is something that's so easy to forget about when you're in a leadership position, and forget about the impact that can have on the people around you when you role model that self-care, and it gives them the kind of ability to self-care themselves. So take those breaks, you know, take back working hours that you've overworked. On the right-hand side here, I've put the 5 ways to well-being. They seem very simple and obvious, but so easy to forget about. You know, as you're going through your day, just take the time to think about how you're giving yourself space to achieve each of these things. Giving, learning, be active, take notice, and connect. They all are, you know, simple ways, but immensely effective to supporting our own mental health and well-being. Help seeking as well. It's so common in a situation like this, when it feels like everybody is under masses of pressure and got a lot to deal with on their plate. You don't want to add another thing to somebody else's plate, but in doing so, you know, that's there might be other people who are struggling with the same thing, and it's so easy to forget about, but just to remember that we're in it together, and the way to progress sustainably is to support one another through this as well. There's some links here to some health organisations such as Mental Health Foundation, King's Fund, Centre for Mental Health. You know, great resources there, particularly about how to manage your wellbeing in the current context as well. So I definitely recommend having a look at some of those websites and some of those resources as well. And take time for yourself, value yourself as well, because it's so easy to forget about. Final thing is just to say, we hope you can all join us for our Q&A following this webinar on Tuesday the 23rd of June. We've got an excellent lineup, so myself and Gareth will be there. If you've got some burning questions to ask Gareth from this presentation, please do. I think on the registration form you can add in a question that you'd like to ask as well, or tweet at us, and we'll collect all those in. And any that you want to ask on the webinar at the day, and trying to find time to explore those with the panel as well. We've got Michelle Morgan, excellent voice and expert around student transitions and the student experience. Sue Rigby, Vice Chancellor at Bath University, you know, has really taken mental health and wellbeing as a key priority. Jane Eldridge, the chair of the MOSHI, the Student Services Organisation, to give us that perspective about the challenges in managing student services, and there's more to be confirmed as well. You can now register your interest on our website, and we'll email you when the registration opens officially. And yeah, I look forward to seeing you there. And please do, you know, we're here to, we don't profess to have all the answers. A lot of the time in the current situation, we're in an uncertain environment. The best we can do a lot of the time is just keep asking the questions, keep exploring more with each other who have experience and have insight. Keep, you know, where are the challenges in implementing all this? And we're happy to explore those and be honest about those with you as well. So really looking forward to this event. I hope it's going to be really, really insightful. And yeah, if you need any more information, you can download the guidance Planning for a Sustainable Future on our website, as I said before. You can sign up to our mailing list to keep up date with the charter more generally, and do email us with any comments, feedback, questions, or anything at all. We're always happy to hear from anybody with an interest in this area in the sector as well. So that's all from Gareth and I, and yeah, just to say thank you for taking the time, and I look forward to seeing you all in the panel Q&A on the 23rd.